First, with all due respect to our friends at the Heritage Foundation, if you'd like to look at some statistics from 2021 from a peer-reviewed journal, I might suggest the BJ Psych Open from November of 2021, which was a peer-reviewed study conducted in the UK, which found that only 1% to 8% of minors who received gender-affirming treatment actually detransition in adulthood. Now, I've been told that there's no political value to speaking about trans children. And I'll be honest, I'm not sure why the challenges of this small community have affected me so deeply, except to say that as a mom whose heart often breaks, watching her own kids struggle, it's difficult for me to watch the hardships this community endures, often without anyone willing to speak up for them. The stated purpose of SB 199 is to protect children who may reach adulthood and have remorse or ongoing side effects as a result of medical interventions made to treat their gender dysphoria before they turn 18. It's a stunning departure from our long-established framework for bringing medical malpractice claims against providers for medical negligence for two main reasons. First, SB 199 allows for an action to be brought against a provider, even if the treatment they provided was within the standard of care and wasn't negligent. This means that a doctor could provide treatment to the patient and do everything exactly right in accordance with accepted medical standards and still have exposure, which is more akin in the law to a standard that we call strict liability. Second, the bill extends the statute of limitations for a patient to bring a lawsuit to up to 15 years after the patient turns 18. For reference, our current medical malpractice statutes say that a minor with a medical negligence claim in many cases has until they reach the age of 19 to bring an action in similar circumstances. There are a number of problems with this framework. For one, doctors in Arkansas are only required to keep a minor's medical records for 6 years following the conclusion of treatment, which means that they would often be finding themselves in a lawsuit without even the benefit of their medical records of the treatment provided decades earlier. For another, I can promise that there's not a single medical malpractice insurer who will write a policy under these circumstances. And because these insurers are risk averse, there is no question that this will affect medical costs for other patients in need of hormone therapy who are not members of the transgender community. And of course, the big consequence, which sadly is likely the point, is that these problems will ultimately result in physicians unwilling to provide treatment for this population at the risk of their own livelihoods and families, meaning that this already vulnerable population will be left even more vulnerable and unable to seek medical care. It's that issue which is ultimately fatal to the bill, because in short, we have what's called a pretext problem. In constitutional jurisprudence, pretext happens when a law is ostensibly neutral, but is actually a justification for discrimination against a protected class, which is subject to heightened scrutiny and ordinarily invalidation of the law. We know transgender kids are a protected class. How do we know that? Well, we know that because the Eighth Circuit already told us so in the currently ongoing litigation against Arkansas regarding the SAFE Act, which banned trans healthcare in the state. In that case, the Eighth Circuit determined that the plaintiffs, trans kids, their parents, and their physicians, were entitled to an injunction against enactment of the SAFE Act pending final trial on the merits. Why is that important? Well, because one of the elements a plaintiff has to prove in order to get an injunction is that they are likely to succeed on the merits, which means they are likely to win the whole case. And a district judge here in Arkansas and a 3-judge panel of the Eighth Circuit, the notoriously conservative circuit in the country, agreed that the injunction should stand. So then we have to ask whether this bill is facially neutral. I would imagine that the state will argue that it is, but the reality is that it discriminates quite clearly on the basis of sex. It doesn't offer the same type of protection to non-trans minors who receive hormone treatments, or minors generally who receive treatment that might have long-standing physical or mental effects. Nor does it similarly burden physicians requiring medical malpractice insurance to care for non-trans minors. This contradiction alone is likely enough for a court to conclude that the law isn't facially neutral and that it clearly targets a protected class. Next, we as a state would then have to prove that the state has a compelling interest in the aims of the law. Of course we do, protecting children, right? That's a winning argument. Afraid not. The Eighth Circuit already said in Brandt versus Rutledge that this very clearly was an example of pretext when they said, quote, "The district court found that the act prohibits medical treatment that conforms with the recognized standard of care for adolescent gender dysphoria, and that such treatment is supported by medical evidence that has been subject to rigorous study, and that the purpose of the act is not to ban treatment, but to ban an outcome that the state deems undesirable. The record at this stage provides substantial evidence to support these factual findings, those findings being that justification by the state was pretext. The analysis here is the same. By establishing this new burden on physicians treating trans children, the state will effectively ban access to this treatment by chilling the willingness of physicians to provide care at the risk of being sued years later or having their medical malpractice insurance canceled. Either way, the effect is the same as the effect of the SAFE Act. These kids and families are denied access to medical care supported by the vast majority of the medical community as within the standard of care. Thus, just as in the ongoing litigation in the Brandt case, it is exceedingly likely that the state will yet again lose a case involving our ongoing assault of this tiny, vulnerable group of kids. As of this morning, the number of kids affected is at approximately 140, and most of them plan to leave at the end of the school year. I'll close going back to what I started with. I don't know why I care so much about these kids, but I think what's more mystifying to me is why we as a body have decided that we must continue to file bill after bill to help a community that has begged us to stop. Begged us. I am still haunted by the idea that last session, doctors at Children's Hospital told us that kids were trying to commit suicide as a direct result of the actions we take up here. And I know that some of you were not here, so let me be clear. Kids tried to kill themselves because of things we said, because of things we filed, and because of votes we made. I certainly won't pretend to be an expert on what the best medical treatment for trans kids is. But I know for certain that I'd rather that they live through this session, have a chance to find out for themselves. I'll be a no.